Okay, this video is why am I still hypertensive after going vegan? Because people sometimes their blood pressure improves a little bit, but not as much as they had hoped when they eat a vegan diet. So of course you want to be low-fat vegan, 100% organic, no salt added. All right, but let's go through some of the things that are going to slow down the progress. Some of them you can fix, some of them you can't fix, but there's good reason to be hopeful, and it'll sometimes take more time. The longer the person has been hypertensive, the more damage there's been to their arterial system, so it's going to be slower to respond. I'm going to go through this list of causes, then I'm going to show you pictures to help clarify everything. So the first of all is the loss of the Windkessel effect, meaning the elastic fibers in the ascending thoracic aorta. And that's like a second heart. When the heart contracts, the left ventricle, it stretches the ascending thoracic aorta as the blood enters the aorta. And then when the heart relaxes, the elastic fibers in the ascending thoracic aorta, they recoil inward, and that generates diastolic flow. That's the lower number on your blood pressure. The top number is systolic, the lower number is diastolic. So the systolic number comes from left ventricular contraction. The diastolic number comes from ascending thoracic aorta recoil during diastole, during the resting phase of cardiac cycle. Okay, so anyways, the longer you've been hypertensive, the more you've lost those elastic fibers. You cannot replace them after you're 20 years of age, so that's not coming back, okay? But there's a lot of things that do come back. Okay, the next thing we're going to talk about atherosclerosis and calcified arteries. I'll show you pictures of that, explain that. Chronic magnesium deficit. People are often quite severely magnesium deficient because they haven't been eating plant foods for a long time, for years, for decades. So it takes time to replenish that magnesium. You need magnesium to run all your ATP reactions. I'm going to show why. I'll show you a picture. It'll make a lot more sense, but it's going to take time to replenish that magnesium. The next thing is fluoride toothpaste and fluoride mouthwash. That kills the good bacteria in the mouth on like the back of the tongue, which are needed to convert plant nitrates into nitrites, and then those go into the stomach and are converted to nitric oxide, a vasodilator that goes through all the arteries in your body and dilates them, and that lowers blood pressure. So you don't want to be using fluoride toothpaste or fluoride mouthwash. Okay, I've got more detailed lectures on all of these things, but I'll show you a picture of that too. It'll make more sense. Next thing is obesity. The fatter the person is, the bigger the body that the heart has to pump to, and it'll increase pressure to pump blood to a bigger, fatter body. Once you go low-fat vegan, you'll tend to optimize your body weight. That can take time, though. That can take a full year if you're 100 pounds overweight. You don't want to eat any processed food, none, zero. I don't eat anything that has more than one ingredient. I only eat organic. You want to avoid all high-fat foods. Yes, high-fat plant foods are all bad. All the oils are bad. Avocados are bad. Any of the high-fat plant foods, I would recommend avoiding them. I would recommend no nuts and no seeds. No fried food, ever. Estrogen overload. I'll talk about that a little bit more, but estrogen's a fat storage hormone. The higher your estrogen levels, and men can have high estrogen levels, the fatter you're going to probably be. So you want to avoid personal care products as much as possible because they almost all have 1 or 2 or even 3 estrogen preservatives in them. You would be amazed if you spent some time reading the ingredient label on these things. Thick blood. And thick blood, of course, high-fat diets are by far the main cause. But leaky gut also contributes because you get the bacterial endotoxins coming through the leaky gut, like LPS from gram-negative bacteria, lipopolysaccharide, and LTA, lipoteichoic acid from the gram-positive bacteria. And those cause amyloid clotting, which means they distort the shape of the blood clotting protein fibrinogen. And that will cause the blood to form little clots, and they're refractory to lysis, meaning difficult to dissolve. Those are called amyloid clots or fibrinolytic clots. Douglas Kell and Atheresia praetoris have written the most about them. But the bottom line is they contribute to overall thickening of the blood. The purpose of blood pressure is to get blood to the top of your brain, your cerebral cortex. So if the blood's becoming thicker, you got to pump higher pressure. The other thing to watch out for is iron overloaded. Most men are iron overloaded by the time they're in their mid-20s. Most women become iron overloaded, within, let's say 5 or 10 years of being postmenopausal or having a hysterectomy. What I do anytime I give blood or I get a blood lab, I don't actually donate blood because I didn't like it, but some people do. That's a faster way to lower your serum ferritin. I just pull off a couple extra tubes and discard them when I, go for a blood lab. Okay. So anyways, because your serum ferritin can do the same thing as LPS and LTA, it can catalyze the transformation of your blood clotting protein fibrinogen into becoming, instead of being alpha helix for its secondary protein structure, becoming beta pleated sheet and more prone to clotting. I'll show you pictures of all this stuff. I'm just kind of going through this summary list, then I'll show you all the pictures. Poor circadian rhythms. I just read a good book called Light Doctor by this guy, Dr. Martin Moore Eady, and he spent his whole life researching it, and basically says Americans get way too much blue light at night because most people have switched out to these blue LED lights that give more light in the blue part of the spectrum, and that's where our photoreceptors in our eyeballs that don't even see vision, just recognize light. To our brain and our eyeballs, blue means daytime. So if you're using blue lights at night, like from your cell phone, your computer, your TV, your house lights, your fluorescent lights, the more blue light you're exposed to at night, the less melatonin you're going to make. So you want to, try to switch out your house lights. You don't want fluorescent lights in your house. They also can give off mercury. You want to, put low watt bulbs in your bathroom. Anywhere you have to go at night, like 15 watts is good. If you're able to obtain incandescent lights, they're better. They give off less blue light. These are things that will help you to sleep better because you want your melatonin to kind of ramp up at night. I dim the lights in my house after, I'm doing anything that I need light for because I want my body to get sort of ready to go to sleep. If you're able to switch your house to hardwired rather than Wi-Fi, that's preferable. If you're able to turn your Wi-Fi off at night, that's preferable. Less EMF, that can help you sleep better. You can consider getting an EMF shielded bed. It's good to see some bright light in the morning, like our ancestors would see the sun when they woke up in the morning, and that would set their circadian rhythms. And then when it was dark at night, they'd go to sleep. But in the modern world, we often are looking at blue lights quite late into the evening, and that prevents us from generating enough melatonin, which helps us to sleep. Melatonin is also an antioxidant, and it lowers your risk of cancer, etc. It's very good for you. Okay, sleep deprivation. The biggest thing is try to get yourself in the habit of going to bed earlier. Try to get 7 or 8, hours a night. And at a minimum, get 6. If you don't get 6, you're probably, headed for health problems. But try to get at least 6. Learn to manage your stress. A lot of people are stressed out. You got a difficult life. Okay, some things in our life we can't change, but do what you can to minimize it. Avoid unnecessary negative things. Avoid unnecessary negative people. Be religious. All religious people from the major religions are healthier. And to some extent, you just have to take up your cross. Most of us, we feel like we're half screwed, but that's better than being totally screwed. Have an attitude of gratitude for what you got, for what's been given to you, and do the best you can with where you are and what you've got. And you get a sense of happiness from that because you sort of say to yourself, well, given my personal circumstances and my age, my ability, my resources, this is the best I can do. And if you do the best you can do with what you've got, then you respect yourself. And because you respect yourself, you like yourself, and you feel better. It's the best you can do. A lot of things we can't change. We can't change a lot of things. But change what you can to make it better and do the best you can. And then you get this sense of psychological strength because you've done right by yourself, by God, by your friends and family, and you feel better. Okay, caffeine. Avoid caffeine. Gradually titrate yourself off of all of it because it increases blood pressure, it increases blood lipids, it decreases sleep quality. Even if you sleep the same number of hours, you don't sleep as deeply. Avoid all stimulants, tobacco. If you're on attention deficit meds, see if you can taper off of them. Check out Dr. Joseph's YouTube channel. He's pretty good. He's the best of the online psychiatrists I've seen for that sort of thing. You can read the books by the other ones who've written about that. Corticosteroid medications will also cause, volume overload and can keep your blood pressure high. If you're eating too much sodium, not eating enough fruits and veggies to get that, fruits and starches to get your potassium levels up. But anyways, all right, let me start showing you the pictures. I kind of got talking. Okay, so here is a look at some of the curves. It's also going to take time for your weight to come down. The weight takes more time to respond. Like if you're 100 pounds overweight, it could take you a year to lose all that. You might lose it faster, but it's going to take time. Your hemoglobin A1C takes 120 days to get to the new optimal level, so that's going to take time. That stiffens your red blood cells, so that's going to make your blood pressure higher because thicker blood you have to pump under higher pressure. So that's going to take time. The average red blood cell lives 120 days. So you can check your hemoglobin A1C at the baseline if you want to. You don't have to. This is especially if you're worried about diabetes. But that's just an example of one thing that takes time. The blood pressure is quite variable, and a person who's otherwise real healthy and has only been hypertension a short while, their blood pressure might dramatically come down in one day. But for other people, it's going to take more time. For some of them, it could take up to a year, and it's never fully going to come down to what it was when you were 18. But depending on how many of these variables we're going to talk about, it's going to take longer for some people. But the other good news is, I'll show you in a moment, the book by Richard Moore, MD, PhD. Once a person optimizes their diet, even as their blood pressure is taking time to come down, their risk of stroke is dramatically decreased. And also remember, this is just an educational video. This is just, for educational purposes. You need to work with your healthcare provider about titrating your medications. If you're on any medicines for hypertension, diabetes, or anticoagulation, you will need to titrate them and work with your healthcare provider because otherwise they'll drop too rapidly, your blood pressure, your blood glucose. If you just go from standard American high-fat diet, high-sodium diet, and all of a sudden eat low-fat, low-sodium diet, your pressure could drop, your blood sugar could drop. Okay, and you could have medication side effects. You got to work at titrating those off if possible. Okay. Here's what I meant by your hemoglobin A1C. When your hemoglobin A1C is more glycated, it stiffens the red blood cell, and so that's going to raise your pressure until that decreases. Here's the guy, Richard Moore, who wrote this magnificent book, The High Blood Pressure Solution, and he talks about the fact that when you lower your blood pressure by optimizing your diet and lifestyle, you get a dramatic reduction in your risk of stroke, and you really don't get that much of a reduction from taking the blood pressure pills. So improving diet, especially diet, but also lifestyle, gives you a much bigger benefit than going the drug route. This is what I meant by the Wing-Kessel effect. The elastic fibers in the ascending thoracic aorta are a second heart, and during diastole, cardiac relaxation part, the elastic fibers recall inward and they generate diastolic flow. So diastolic is the bottom number, systolic is the top number. And the more diastolic flow you can generate in this manner, sort of a passive manner if you will, the less systolic pressure you're going to need, so the lower your blood pressure will be. And these fibers aren't coming back. So this is one of the things that the longer the person's been hypertensive, the more they have lost the elastic fibers, the more difficult it is to get their blood pressure down. Okay. All right, and then again, what's the purpose of blood pressure? To get blood up to the top of your brain. And you're going to have some baseline atherosclerosis in the carotid arteries sometimes, in the intracranial arteries sometimes. And so that can partially be reabsorbed, but it takes time. Okay. And here's what I meant by baseline atherosclerosis, let's say in the smaller arteries in the brain. Here's a normal looking artery. The red blood cells are passing through the capillary. The yellow is the capillary basement membrane. The green is like the vascular smooth muscle cells or pericytes in the brain, you might call them. And if a person's been chronically diabetic, chronically hypertensive, they're going to have a thickened. The yellow lining here is the capillary basement membrane. That's going to be thickened. And remember, the goal is to deliver these blue circles to the brain cells, the neuron here. So the more chronically you've been diabetic and atherosclerosis, the thicker the capillary basement membrane is going to be, the more vascular smooth muscle you're going to have around your small arteries. So it's going to be harder to deliver oxygen. These can gradually reabsorb a little bit, not fully, but this is what I mean by it's going to take some time. But you're already, right from the get-go, going to lower your risk of stroke, and you're going to quite often resolve your angina. Not everybody, but very often in Dr. Esselstyn's experience, for example, within 2 to 10 days, they've seen a dramatic reduction in cardiac angina. It's pretty routine finding in his experience because you get restoration of the nitric oxide production by your arterial lining cells, your endothelial cells. This is an atherosclerotic plaque here. Atherosclerosis is a blood clot, and the good news is that it's largely reabsorbable, okay, partially reabsorbable. You can reabsorb the acute clot component. You can reabsorb the lipid core component, the fat in the plaque. You can reabsorb the necrotic core, the dead tissue in the plaque. The fibrous tissue, if it's early on, where it's still highly cellular, that can partially reabsorb. Once it's old, It's just frank scar tissue, with collagen. You're not going to reabsorb that, okay? And you're not going to reabsorb the calcification. Now, I know there's some people on the internet saying you can reabsorb the calcification. I'll believe it when I see it. Maybe it can happen, but I haven't seen it yet in my clinical experience of, many, many, many tens of thousands, hundreds of thousands of patients. So maybe it can, but I wouldn't hold my breath on that one. Okay, so the good news, though, is you can shrink this at all, plus the endothelial nitric oxide production, the vasodilator that these cells make, will start coming back pretty fast in the first week, and so that can cause a big improvement. So here's an abdominal aorta. Here's the right common iliac, left common iliac, internal iliacs. Here's the renal arteries, the splenic artery. The reason I'm showing you all these white spots are calcifications. So people who've been chronically hypertensive, diabetic, for decades, and especially if they have kidney failure on top of it, the longer they've had these chronic diseases, the more this calcification they'll have in their arteries, and the harder it's going to be to get their blood pressure back down to optimal levels. Again, you can dramatically improve things, and it's definitely worth it to go for it, because when you go low-fat vegan, you don't just improve blood pressure, you improve everything. You improve how your cells function. You decrease your risk of diabetes and diabetes complications. You decrease the risk of end-organ damage of diabetic retinopathy, hypertensive retinopathy, congestive heart failure, chronic kidney failure. Okay, everything gets better. That's why it's such a great deal. This is what I meant about you don't want fluoride toothpaste or fluoride mouthwash because they kill the bacteria in the back of the tongue. Normally when you eat plants, they contain what are called plant nitrates, NO3. On the back of the tongue, these bacteria convert them to nitrites. That should be a letter I here. Nitrites are NO2. So this is a nitrogen bound to 3 oxygens, nitrogen bound to 2 oxygens. Then in your stomach, the stomach acid converts the nitrites, NO2, into NO, nitric oxide. And that goes into your arteries, and that has a systemic vasodilation effect, opens up all your arteries. You also want to be careful about medicines like antacids and proton pump inhibitors, because you need that stomach acid to convert from this step, NO2 to NO. Okay, all these things cause vasodilation. Good to get some sunshine too. Sunshine generates nitric oxide from skin, subcutaneous precursors. So that's also good for you. We're made to walk around outdoors all day long in extended family groups looking for food. Okay, this is what I meant by you need ATP to run the plasma membrane sodium potassium ATP pumps, which is 30% of a third of the energy in a regular cell and 2/3 of the energy in a brain cell. So what I'm saying is until you've got adequate magnesium levels, you're not going to have optimal running of these ATP pumps. And it can take a long time to replace all that magnesium. So you want to get going on eating your plant foods to get your magnesium up. In some case with your healthcare provider, you might even supplement magnesium for a while, but I will leave that up to you and your healthcare provider. But the bottom line is eat your plants. That's where your magnesium comes from. And you're going to need your magnesium to run these ATP pumps, okay? Also, most people are potassium deficient, but that's easier to restore. Here is magnesium. Magnesium hangs on to the second and the third phosphate on adenosine triphosphate. That's ATP, triphosphate. TP is from the 1, 2, 3 phosphates. But you need the magnesium to hold the third phosphate in place. Otherwise, it'll detach too readily, too easily, too soon, because these negative charges repel each other. The 2+ positive charge of magnesium holds them together. That's why I call it the heroic ion, the brave uncle. Okay, you need magnesium, and there's no way you're not going to just eat your plant foods. Magnesium is located in the center of chlorophyll in plants. That's where you get it from. So you eat your plants and you'll get it. Okay, and then we talked about how the cell is going to maintain an inner concentration overall of the combination of potassium and sodium constant. Okay, so there's no way around this. There is no way around it. Either you eat the plant foods or you're not going to get as much potassium. Potassium comes from inside cells, from whole plant foods, and magnesium as you need to optimize your blood pressure and your cellular function. There is no way around it. There's no medical, surgical bullshitology can fix this problem. That's why you have to eat the plant foods or your health is screwed. So here is, let's say, a normal artery. The red is the amount of flow of the lumen, the blood flow. This is a vasoconstricted artery. Constricted, so you have a narrowed lumen. This is a vasodilated artery, okay? So what dilates your arteries? Getting some sunshine, getting some exercise, avoiding unnecessary stress, being warm, getting your plant nitrates. All that stuff is good. What narrows your artery in a bad way? You don't want this, okay? all the stuff that causes diabetes and hypertension, okay, and stimulants, vasoconstrictor stimulants, caffeine and all that. You also want to make sure you're getting dietary fiber so that your gut, your good bacteria in your gut, they take the fiber, make it into butyrate, 4-carbon short-chain fatty acid, and that's used by these cells to make your tight junctions. It's also used by your brain cells to maintain the tight junctions of the blood-brain barrier. But the bottom line is, if you don't eat enough dietary fiber, you end up with leaky gut with a gap in the tight junctions. Other things that can damage the gut are excess stress, caffeine, alcohol. You don't want to be drinking any alcohol. Alcohol is bad. You don't want to smoke any cigarettes. It's all bad. Watch out for non-steroidal anti-inflammatory drugs, NSAIDs. And here's a whole bunch of other things that cause. I got entire separate lectures on it, but the most important thing is eat enough dietary fiber, okay? Because if you get these bacterial toxins coming through the leaky gut, the leaky gap junctions, tight junctions here, instead of having tight junctions, you have holes in it. These will make your blood a little bit more prone to clotting. They'll thicken your blood a little bit, and that can increase your blood pressure and cause some systemic inflammation. This is just showing the gram-positive bacteria have an LTA endotoxin, gram-negative bacteria, LPS endotoxin, excessive free iron. They all do the same thing. They change the blood clotting protein fibrinogen from alpha helix secondary protein structure into beta pleated sheet secondary protein structure, whereby the sheets stick together with each other like a stack of cards. These are like slinkies, cylinders. Kansas, they don't stick together. Okay, these guys stick together like a deck of cards. They're flat. And then they form little clots in your blood, and they make your blood thicker, and that'll drive up your pressure. Okay, the other thing we talked about, how being estrogen overloaded increases the risk of fibroid tumors in the uterus, and women get hysterectomies from that. They stop menstruating. That'll raise their blood pressure. Also, the elevated estrogen levels increase their breast cancer risk and their prostate cancer risk. And here's what happens. If you don't eat the dietary fiber, you get bad bacteria in the gut that have more of this enzyme, glucuronidase. Good gut bacteria don't express this very much. So the problem is, we normally excrete estrogen from our body, and we want to excrete our excess estrogen because estrogen is a fat storage hormone. So if you're estrogen overloaded, you're going to be more likely to be fat because it gets the body to hang on to store more fat. So anyways, the point I'm saying is the bad gut bacteria make glucuronidase enzyme, and that cuts the connection between the estrogen and the glucuronic acid. And once the estrogen is free from the conjugated glucuronic acid, it will be reabsorbed into the blood. So how do you prevent all this? When you eat dietary fiber, you have good gut bacteria. They don't express this enzyme, and the estrogen that your liver did you a favor conjugating will be defecated out of your body, and that'll keep your estrogen levels low. So people who have lack of dietary fiber end up having high estrogen levels, and that increases the risk of obesity, of breast cancer, of prostate cancer in men, and also in women of fibroids of the uterus. Okay, and then, here's basically the formula. I call it the Spartan vegan pyramid of health. It's Spartan because it's simple, and it's also cheap, and that's also a little bit my philosophy of life. I'm a former wrestler, okay, and I like to keep my life simple. And then, here's the pyramid at the bottom. Try to maintain good relationship with family and friends and coworkers, things like that. Try to get your exercise. At least try to walk every day for at least an hour overall if you can. If you can do more, that's great. Walk upstairs. That gives you good exercise. Do some type of strength exercise. Just plan it into your day. I've got entire separate videos on that. Get your sunshine. We're made for that. Try to get adequate sleep. Be religious. Religious people are way healthier. It helps you in life. Atheism is stupid. It doesn't make sense scientifically, and it just leads to failures in life. Starches, it should be the main source of your calories. Dr. McDougall recommends 90% of your calories from starches and then 5% from fruits and veggies. And starches, they're cheap because people say, well, can I afford this? Well, you're going to save money. You'll probably come off a lot of your medications if you're on any. Starches store for a long time. Oatmeal with water is cheap. You can throw some fruits on it, make it taste better. Quinoa is a lot like oatmeal. White rice stores a long time. It's really low in fat, 1% of calories in fat for white rice, sweet potatoes, and potatoes. So those all help a person lose weight. Lentils have only 3% of calories from fat. Black beans have only 4% of calories from fat. The point is, any of these low fat percentage of calorie foods, they tend to make you skinny. Get some fruits, get some veggies, and take a vitamin B12. If you're vegan, 100% vegan for a while, you'll eventually need to take vitamin B12. Okay, I think that's all I've got. So anyways, those are things that explains why it can take a while for blood pressure to come down. But the good news is, as soon as you start optimizing your diet, you improve the health of every cell in your body, and you'll start getting improved function pretty fast. But how long it'll take to get your blood pressure down into the best possible range, that can take a while. That can take, a full year. So I would recommend just doing the best you can with it, and keeping track of your progress. Work with your healthcare provider to titrate your medications or assist you in whatever other way is relevant. This is just an educational video. I hope you found it helpful.